Good afternoon, everyone. I am Dr. Rajat Kandhari, a consultant dermatologist from New Delhi in India. And I hope all of you are keeping safe and sound during amidst this global crisis that we all are facing in the form of COVID-19. It is a tough and crucial time. We all are locked in, and I think all of you must have heard a lot about social distancing, hand hygiene, and usual respiratory hygiene as well. So today I thought that instead of talking all about just COVID, I would try to defocus and de-stress all of you and take you towards something which we usually take for granted, which is the largest organ of our body, the skin. So this is a good time to start taking care of our skin as well as our hair. So there are many times where we're going to an event and we hear our friends and we hear our relatives and they're telling us that this is a good cream that I used, and we end up using the same cream only to make things worse on our face. And that happens because my skin and your skin, all of our skins may be a little different, and because they are different, we need to understand that each skin may require a little different treatment. So, what I'm going to do today is I'm going to try and bust some of the myths which are associated with skin and hair care. And what I'm also going to try and do is tell you some frequently asked questions which I'm usually asked, and we'll go through with that. And please, I welcome all of you, and please keep your questions rolling. So one of the common questions which I'm asked, and this was asked recently by a patient of mine called Shruti. So Shruti asked me that, Doc, please just prescribe me natural products. Don't give me anything else. My skin is very, very sensitive, and I would only want to use natural products to be applied on my skin. So what I usually say is, suppose we make a glass of orange juice and we keep that in the fridge. When would you like to have that orange juice? You would like to have it on that particular day, right? You wouldn't like to have it 1 week later. It would be stale. It would be decayed, literally. So the same thing with skin products. If you keep something in a jar which is completely natural and you use it, say, after a month, I don't think it's going to be very, very good. So please, there are lots of companies which claim natural products, but obviously all of them have a few preservatives to maintain the stability of their product. So choose your product wisely, choose the ingredients wisely. So there are a lot of things which are trending nowadays in the form of natural aloe vera, tea tree oil, so on and so forth. Even these things on very sensitive skin, they may end up reacting on the skin. So one should be very careful of what they're using, or take advice from your dermatologist and be sure of what you're using before you go on to use it on something which is precious, which is your skin. Secondly, another very common question which I'm usually asked by some of my patients, this was asked to me by Webvi, that my friend is using a very high SPF sunscreen. So there are sunscreens which have SPF nowadays of 60, 70, even up to 100. So I'm going to use that, and I have been using it, but my skin still looks pigmented. Why is that? So one must understand that SPF is essentially a measure of the UVB protection of the sunscreen. What that means is the sun gives off three spectrums: UVA, UVB, and UVC. What reaches us the most is UVA. Why SPF is so popular is because over the past many years, that was the only measurement of a sunscreen that we did have to measure its protection. So when you go to buy your sunscreen, please make sure, other than the SPF, you also look for the label, which also gives you direction to what the UVA coverage of the sunscreen is. You want a broad spectrum coverage for your sunscreen. Apply it judiciously, apply it 20 minutes before heading out into the sun. So a sunscreen which gives you a good UVA and a good UVB protection, that means has a reasonable SPF, says anything above 30, and also has a good UVA protection, is a sunscreen which is a good sunscreen to use. So use that, and that will help you protect your skin a bit. There are also many sunscreens pouring in nowadays with what we call infrared protection, or there are many sunscreens pouring in nowadays with anti-pollutant effects. Well, I mean, these do help to some extent. There's not a lot of data supporting them, but yes, there is some data supporting them, and they may help. Whether they'll completely cure your blemishes or your pigmentation, no, they won't. But they'll help in preventing them from getting worse, right? So that's what happens with them. Which cleanser should I use? Which is the best night cream to use? Which is the best moisturizer to use? Now, these are very commonly asked questions. Now, I said something before I started this talk that my skin and your skin are different. So clearly, there cannot be a best night cream, there cannot be a best sunscreen, and there cannot be a best cleanser. So if someone has acne prone skin, someone has a lot of pimples, very oily, greasy skin, the cleanser they would be requiring would be a more exfoliating cleanser. If someone has a sensitive skin or is very prone to allergies and very dehydrated dry skin, they'll require something which is much more made for sensitive skin or is very, very mild. So you need to weigh these options. Again, with the night cream, someone with a greasy or oily skin will require a fluid or a gel-based cream or a serum maybe, rather than someone who's got very dry, sensitive skin. They would require something a little more creamy to hydrate their skin. So these are certain things which we need to know about and which we need to understand before going in and choosing a product. And if you do not if you're not clear about it, please get your skin analyzed by a dermatologist before you use or choose to use any ingredient on your face. Vidya recently asked me, Doc, I'm in a corporate job, I've been having tough hours, I haven't been getting enough sleep, and I have a lot of dark circles and puffiness around my eyes. How do I deal with this? So, are dark circles caused by lack of sleep? Well, sure, yes, lack of sleep does cause dark circles to some extent, but what you really need to get down to is what is the underlying cause of your dark circle. Dark circles are commonly caused in nutritional deficiencies. So, if you're not eating well, if you're iron deficient, if you're allergic to certain things, if you're insulin resistant to certain things, so you need to weigh all these things. You need to consult your doctor, understand what the underlying cause is, because if you do find an underlying cause, you address that cause, because treating dark circles is tough. Sure, getting good sleep as well as having a very well balanced diet, good in antioxidants, is a good idea to go by, so that these things would be decreased, but that's not the only cause. Another patient of mine, Shreya, she recently she came to me and she was very, very nervous and very, very disturbed. And why was that? She was having immense hair fall, uh, like clumps and clumps of hair in the drain, clumps and clumps of hair on the pillow, so on and so forth. And she told me, I recently shifted to Noida and the water there is very, very hard. And that's why I'm having this hair fall. So again, water is hard all over Delhi, all over NCR, all over India. It's not the only cause of your hair fall. Sure, hard water can make the quality of your hair a little bad. It may cause maybe some reversible hair fall. But what you need to really identify is what is the underlying cause. Is there any problem which is underlying? You need to find this. This is a condition wherein you have such aggressive hair fall, is a condition called telogen effluvium. It usually happens to certain stresses in your body. For example, very common post pregnancy, and this will happen about 3 to 4 months post pregnancy, 3 to 4 months post a dengue fever, a chikungunya fever. If you're going on a crash diet, please be very, very careful and be prepared that you may face massive hair loss maybe 3 to 4 months later. Straightening, rebonding, again, very common causes of such hair fall. So before naming the water in Noida, please make sure that you clear out these things with your doctor, as well as clear it out, especially your iron levels as well. If your iron is very low or your menstrual cycles are off, that could be a common cause of such kind of hair fall. So please make sure these things are in order before you blame the water in your vicinity, right? Uh, Coming a little bit towards the anti-aging regimen of skin. So a common thing which many people say is, Doc, I'm only 40 years old. I don't think I need anything anti-aging. It's too early to apply anything or get any procedure done. So I typically tell them that it's not the age which is the factor. It's more about the indication presenting itself. So if you've got lines like me, you need to probably get some treatment, or think of starting an anti-aging regimen. This may vary for a person who's 25, and it may vary for a person who's 40, and it may vary for a person who's 65. And however, simple things which can be done are hydration. Hydrate your skin well, use a good moisturizer, drink plenty of water, um, use a good exfoliation, particularly at later stages. So maybe after 40, 45, you need to use a good cream, serum, etc., which will help you exfoliate your skin a bit. This depends on how dry your skin is. So if it's very, very dry, please be a little wary of aggressive exfoliation or aggressive scrubbing. It may not help too much, and it'll just dry out your skin even more. And of course, a good sunscreen and a diet rich in antioxidants. These are few things which you can do to start off with, before considering what else you can do. Further, there are certain times when people also ask, Doc, my friend just went to her doctor and she got this amazing vitamin and glutathione infusion to look fair and glowy. This is a tricky one. Nowadays, a lot of people are wanting to get glutathione infusions. I'd just say that, let's be happy with our skin colors. Depigmentation or decreasing pigment is a good sign. It's a side effect of glutathione essentially. And orally is great to take, but IV infusions can maybe wait before one sort of makes it sure that we want to do this. Anyways, when we do this and come off it, the color may come back, and it individually may vary from person to person. After all, every person doesn't get the undesirable effect of one medication in the same measure, do they? Um, Doctor, I had some acne and I want to go somewhere. Can I put toothpaste on it? This is an old hack which has been used in the past, and toothpaste previously used to come with something called triclosan, and now they do not come with that too much. And basically, what you can do is avoid this completely, because you can end up with burns on your face. So please avoid doing that. Another common thing in acne, when a mother asks about her child, is that, Doc, my child is only 14. I think I can avoid treating him right now. Pimples will happen. Please treat your acne early. The mother might say that, but the child may go through psychological effects and scarring at a later stage. So please don't wait, and please treat it. Before I start taking your questions as well, one or two last ones which I've been asked recently. Uh, Doc, do facial exercises help in decreasing wrinkles? Simple answer, facial exercises, it has been proven in data, do not really help in decreasing wrinkles. Please go to the gym and do your squats, do your lunges. They are better off than your facial exercises. They may help to some extent, but they definitely will not pull away your wrinkles. So hi everyone, Vaibhav Gala, he's asked, Doctor, can you suggest how to reduce blackheads? Well, use a good cleanser for your blackheads and visit your dermatologist. You essentially need something which would have benzoyl peroxide, tretinoin, or adapalene. But please address this with your dermatologist before starting to apply these, because all of these are slightly irritating. So make sure that your skin is in good health before starting to use this. Hi Suresh. Suresh Kapoor, he's asked, does using face wash is better than soap? Well, it completely depends on the kind of skin you have. So if you've got, and also it also depends on your preference. Today you can get a soap and a face wash which would do exactly the same thing. It's just your personal preference. If you prefer to use a face wash, it's fine. Otherwise, a soap would also do the same job. Dry skin, use mild soaps, mild cleansers. Oily skin, use something which will help in cleansing a little more, as well as degreasing your face and decreasing the oil and sebum and the grime off your face. Prince, hi Prince. He's asked hair fall during pregnancy. What should be the solution? Prince, so I'm obviously assuming you're not pregnant, but someone you know is. Um, Hair fall during pregnancy. During pregnancy, hair fall typically does not happen because during pregnancy you have good hormones and they'll make your hair thick. In fact, if you're having hair fall during your pregnancy, please visit your dermatologist or a doctor because there might be some underlying hormonal trigger or an iron deficiency anemia. The hair fall post pregnancy typically happens about 3 to 4 months post the pregnancy, post the delivery. This is because the delivery per se is an insult to the body, or it's a stress to the body, and your hair also perceives this as an insult. So when it does so, it takes about 3 months to go to what we call the falling phase or the telogen, and there's massive hair fall. But it's nothing to really panic about because it usually settles down on its own. However, it's fairly alarming for the patient as well as the people around them. And if that be the case, visit your dermatologist and take the necessary supplements as well as treatment for that. Vaibhav again has asked, nowadays there are many topicals which say alcohol free. How essential and important is it for our skin? Um, I'm not quite clear what you're asking about that, but this typically happens in hair care. More so when they say alcohol free, the idea is that they're not irritating. And if it's an aqueous base, it'll be much more tolerable to the skin. If you're using a toner for your skin or a cleanser, I would urge you to use something which is alcohol free rather than with alcohol. When you use alcohol, it'll strip the barrier of your skin. In times of COVID-19, particularly when we're using sanitizers so frequently, sanitizer is 60 to 90% alcohol based. So if we keep using it on our hands, we'll keep noticing creases as well as extensive dryness on our hands. This is because extensive sanitizing will strip the lipid barrier of your skin, and once it does that, you need to use a good moisturizer with it. Otherwise, it'll keep getting worse and worse and break into an eczema and may even start oozing. So please, during this time of COVID, use a good gentle soap, and particularly when you're at home in lockdown, rather than repeated sanitizer use. Anyways, a hand wash will be much better than just the sanitizer. Hi, Uzma. Uzma has asked, I'm having a question. Nowadays, I'm using tretinoin 0.025 once in a week. So, what I should use the rest of the day? I don't know why you're using it once a week, because ideally tretinoin should be used every day. And if you've got very sensitive skin, you can make it twice or thrice a week and then go on to the rest of the days. Otherwise, if you depends on what kind of skin you have. If you've got fairly tolerant skin, I would recommend you use a mild exfoliator for your skin in the form of glycolic acid. And if you don't, and if you have got very sensitive skin, I would urge you to use a cosmeceutical based product which helps acne or decreases oil a bit rather than anything too aggressive. Vedhali, hi Vedhali, how are you doing? She's asked, how can I identify my skin type? Well, when you wake up in the morning, if you've got oil out here and not out here, typically that is combination skin. If you've got oiliness all over, if you wash your face in the morning, but in a few hours you feel the oil and grime on your face, that's oily skin. And if the skin is dehydrated and you're feeling it parched, that's typically dry skin. So there's simple dry, oily, as well as combination skin. Combination skins, people sometimes find it a little hard to identify it very easily. So, well, I mean, you can, this is an easy way to do it. Hi Sapna, how are you doing? Sapna's asked, is skin texture genetic? Um, Yes, to a fair extent, it could be. It could surely be. So if your mom's got open pores, surely you could end up having open pores as well. If there is pigmentation which runs in the family, or dry skin which runs in the family, surely one. If I have someone in my family with dry skin, I could definitely end up with dry skin. Or if I have someone who's got excessive oil secretion, sure, I could end up with excessive oil secretion on the face as well. So yes, it can be genetic, but there are many other factors as well. You must realize that the day and age that we live in, the environmental and other triggers are way more than what they were earlier. What's put in our food, what's put in the plants is very, it's much more today, in a day and age when you have reports of pesticides which are being pumped into what you eat, is very different than what you had earlier. So all these things have a certain clear effect on your skin as well. So sure, genetic aspect does exist, but it's more multifactorial. Hi Tushar, how are you doing? Tushar has asked, how is glycolic acid for melasma treatment and what concentration is okay for the face? Glycolic acid is good for melasma. It's a good thing to use. It can be used for the face in the form of a cleanser, or it can be used in the form of a cream. It can be used also in the form of a lotion. Typically, I'd like to start anyone with a concentration of anywhere between 2 to 6% when I'm using a topical product or a cream, depending on how their skin is. If their skin is very tolerant, I'll go high up on the concentration. If their skin is a little intolerant and very, very dry, I'll wait and go with a slightly lower concentration. Typically, also glycolic acid is present in face washes. The contact time of the face wash is not so much, but yes, they do help to some extent to clean or exfoliate and degrease your skin. By degrease, I mean decrease the oil on your skin. I can't say that they definitely help the pigmentation on your skin. Hi, Ranjit. Ranjit is asking how to prevent itching in psoriasis. Uh, this is a googly question because typically in psoriasis, what the literature says is psoriasis is never so itchy. So if you're having itching in the psoriasis, probably it's a little eczematized or your skin is very, very dry. So the first thing I would do is use a good moisturizer and an emollient. And if this is not settling it, I would want you to visit a doctor because they may want to advise you certain creams in the form of cortisone creams, which will help this itching and help the psoriasis itself. Hi Giriraj, how are you doing? Nishima Kapoor, hi, how are you? She's asking how to reduce dark circles under the eyes. Nishima, I don't think anyone in the pharmaceutical industry and us doctors have a full answer to that. I mentioned in when I was saying, I think what is important is you need to identify the cause first. If there is an underlying cause, please address the cause. That helps. Get good sleep, have a good, well balanced diet, and yes, visit your dermatologist. Ask him or her what is a good cream which you could use for dark circles under the eye. It depends if it's just a basic dark circle, if it's dark circles with puffiness, if it's dark circle with fine lines. All these three would require slightly different treatment regimens. But simply, you could start off with a step one, a peptide based serum, maybe, which would start doing something and is relatively safe to use. Hi, Reena Sharma, how are you? Is there any cure for lichen striatus of a kind of thing on a cheek? Um, well, if it's lichen striatus, yes, there is treatment for it and it slowly fades over time. A lichen striatus kind of thing, I'm not sure what you're really talking about, whether it's lichen striatus or not. However, if it is lichen striatus, before seeing it, I would say that please visit a dermatologist so that he can tell you what it is and what to take for it. Because typically, what we prescribe for lichen striatus are cortisone creams sometimes, and I wouldn't want you using those unnecessarily on the face and wouldn't want to comment on it without seeing the actual condition. Hi Tane, how are you? Tane has asked, what is laser toning and does it clean the face? Laser toning is a very, very trending treatment. It's a treatment I enjoy doing actually. So it has two aspects, laser toning. So laser toning has two aspects. One aspect is what we call a genesis mode of the toning. This is for people slightly older as well and people who are prone to acne. So this firms up your skin a bit and it gives the skin a very nice texture, a supple texture. And the other mode is called the toning mode. This mode helps in decreasing the pigmentation on the skin and decreasing the unevenness, the slight pigmented spots, etc., etc. So what you're getting is two things in one go. So it's also called dual toning, and it's a good treatment. It's a good treatment for pre-event. It's a good treatment for a younger patient and for an older patient looking to start off with something mild. Um, Thank you, Anoop. Thank you, Mr. Sharma, for the initiative as well. Ankur Sharma has asked, hi Ankur, how are you? He's asked how to treat a sunburn. Well, Ankur, to treat a sunburn, your skin must be fairly parched red when you're burnt in the sun. I hope you're not getting a sunburn right now, particularly when you're in lockdown. Um, a sunburn is typically treated by a cortisone based cream and a good barrier repair moisturizer so that your skin is repaired in barrier. Once you achieve that to some extent, start using a good sunscreen, because once a person is sunburnt, they have a tendency to get sunburnt again. So please make sure you're using a good broad spectrum sunscreen, as we mentioned prior as well. Hi Praveen, how are you? Can you please explain, Doc, what is the dosage of IV glutathione and tablet? Yes, I mean I can tell you the tablets. The tablet form is used from 500 milligrams to up to 2 grams a day. A typical dose, a right dose, would be 1 to 2 grams, anywhere between that, and it's fairly safe because the absorption is a little limited. There are some effervescent tablets now available. There are some lozenges tablets now available. They have a better bioavailability. So it may be a good idea to consider using those with respect to efficacy. As for IV formulation, 600 to 1200 milligram per day or per week actually can be used. I don't usually encourage this. And as I said prior to starting this, let's be happy with the skin colors that we have. Um, Hi Sandesh, how are you doing? Venkatesh has asked, hi Venkatesh, how many months we have to see glutathione tablets, the results? Well, that's the thing with glutathione. There is no protocol right now with glutathione. So the only guideline which does exist says that if a person is slightly fair, then they need glutathione for shorter periods. If the person is brownish to dark, then they need it for 6 to 9 months. And if the person is very dark, then they need it for even longer periods. So there is no fixed protocol for glutathione. And like I said, this is an undesirable effect of the glutathione, which is the decrease in the pigmentation. So if Venkatesh, if you take a tablet and I take a tablet and I get a side effect of that tablet, it does not mean that you will definitely get that side effect. So that's why the results of glutathione become a little inconsistent. And IV glutathione, just for the viewers, it is in fact banned in certain countries. So please be wary before jumping to using these things. Nandini Sharma, hi Nandini, how are you? I have a psoriatic patch on my hands and having a lot of problems while washing dishes now. Moisturize, moisturize, moisturize. Use a good moisturizing or barrier cream. Use that before washing your hands. And if you're having cuts along with that, it's time you see a doctor before because the detergent of the wash will only keep making it worse. And if you're particularly if you're washing dishes, and use a very mild soap or a cleanser for washing your hands as well. Sunil, hi, how are you? Can hair transplant give lasting effects compared to topical treatments and serums? Sunil, it all depends on what kind of hair loss you're facing. So if there's there are 7 grades of baldness. So if someone's in grade 2, 3, 4, a topical treatment and serum can give them fairly good results. But if someone is in a advanced stage of baldness, I would say please consider a transplant, particularly if you're younger person and if you're concerned and if your job demands that you have a full crop of hair, because just by doing the topical solutions you may not completely get optimal benefits eventually. However, whenever you even do get a transplant, pre and post treatment will only enhance the benefit of this. So keep that in mind when you're doing so. Hi Shraddha, how are you? Sorry, I missed someone. I missed. Hi Mujib Ansari. Hi Mujib. He's asked how to reduce dark circles and melasma. I think I've already covered the dark circles aspect. So I'll shift over to the melasma aspect. For those of the viewers who don't know what melasma is blemishes on the face right here, particularly sometimes here, sometimes on your forehead. This is pigmented spots on the face. How to reduce melasma? I'm glad you asked how to reduce and not how to cure, because we it's tough to cure melasma per se, but yes, we can definitely reduce it. First and foremost, a good broad spectrum sunscreen for melasma. You need to use a sunscreen which will give you a broad spectrum protection. You need to use a sunscreen which will have adequate SPF. You need to apply it adequately. Please don't apply this much sunscreen. Please apply at least, it is said that you apply almost one fingertip unit. So if you're not applying this much, at least apply the fingertip unit, which is about this much for your full face, right? And if you can apply a teaspoon rule, it's called. So sometimes it becomes impractical to use these things because you'll end up using a lot of sunscreen. But at least if you're applying it, use it adequately and cover your face well enough. So this will prevent your melasma from getting completely, maybe a little worse. Other things which you can consider are topical treatments and medications in the form of what we call hydroquinone, kojic acid, azelaic acid, so on and so forth. There are numerous, and there are many cosmeceuticals as well. It all depends on the severity of your melasma, and please visit your doctor for this, or contact anyone close to you so that they can help you out after seeing what kind of melasma you're facing. Hi Shraddha, how are you? Shraddha is asking which PRP tubes should be used for treatment. It doesn't really matter what PRP tubes you're using for treatment per se. If adequate treatment protocol is followed, a normal tube and a kit would, in my opinion, do almost similar jobs. However, yes, there are some kits which do claim enhanced benefit. There are some of the kits are closed systems, which means that they give you more of a sterile environment. So particularly if you're using it for areas such as your bone, then maybe it may be a good idea to definitely go for a closed system. Hi, Ms. Sharma, Sunita. My son is having dandruff since birth, and now he is 17 years, but it's occurring again and again, even after treatment. Is there any permanent solution for the same? Golden dollar question. The dandruff happens because of excessive oil secretion from your oil gland. Yet, another myth, we keep applying oil to decrease dandruff. So, in case you're applying oil, first and foremost, decrease the usage or stop it. If at all you have to apply oil, use it for 2 hours on a Sunday and then wash it off. Now, coming to why he's getting it again and again, it's because his oil glands in the scalp are very, very active and his excretion rate of oil is high. That means it's producing more oil. More oil will keep getting dandruff. Is there a cure for it? Tough to say. Is there a control for it? Most definitely yes. So if it keeps occurring again, I think it might be a good idea for him to put it in his regimen that he uses an anti-dandruff shampoo. There are numerous of them in the market, particularly ketoconazole containing, selenium sulfide containing, tar containing shampoos, ichthyol pale containing shampoos. These can be used at least once or twice a week in his case. If he likes, he can mix his own shampoo with it to give it a better feel. But if it's more severe, please visit your doctor, whoever is close to you. Hi Ruby, how are you? Ruby's asked which sunscreen is good for combination skin, sir. Um, so a sunscreen is again a very personal preference. I prefer fluid-based sunscreens for my patients. However, fluid-based sunscreens may be a little more expensive, particularly, and so a good choice in the Indian scenario are gel creams, particularly in hot and humid conditions like ours and the tropical conditions like ours. And gel creams are available all over the market. Many companies have them. A gel cream which would be a good sunscreen for combination skin, and if your combination skin is a little towards the dry side, you may prefer a fluid or a lotion based sunscreen as well. Hi Savitri, how are you? Savitri, Ms. Kashyap has asked how to reduce my hair fall. Uh, well, I think I've covered this quite a bit in the talk, that how to reduce the hair fall completely depends on why you're having the fall. If you're having massive amounts of hair fall, I think you need to check the conditions which I mentioned earlier, which includes your iron, your diet, your thyroid, and other hormones and other nutritional deficiencies. If all of them are okay, then address the issue by visiting your doctor and starting treatment for it. In the meantime, at least you could start supplementing with a diet which is rich in iron and protein for your hair fall. Hi, Vaibhav again. Doctor, how do you take care of a small group of bump on the forehead? Vaibhav, thank you for your question, but this is it's a little, I will need to see that to answer it loosely like this on a live platform like this. Savitri Kashyap again, treatment for dandruff. I think I've already taken that question, so that's what you need to do. Hi, Uzma, how are you? I'm not fair, but my skin is very sensitive and having pigmentation on the T point. What should I use to for evening my skin color? My doctor suggested me to use tretinoin once. Okay, so okay, now I understand. So you were using the tretinoin for this once in a week for the pigmentation. Sure, so you can use tretinoin once in a week, but even for the pigmentation, if your skin is tolerating it well, at some point you may want to consider increasing the frequency of that rather than sticking to it only at that point. Roshni, hi. I have developed pores and freckles on the cheek. What should I do? Open pores are fairly challenging to treat, Roshni. However, there are treatments in the form of something called microneedling radiofrequency now available for this. And there are certain pore refining serums in the market which you can use. For the freckles, please use a very good broad spectrum sunscreen. And also, you can start considering using depigmenting creams in the form of what I've already mentioned earlier. Hi Anmol, how are you doing? Anmol is asking how far eating habits define our skin type, and what's an ideal food habit to have for a good skin. So I always tell my patients, so some of my patients keep asking me, Doc, it's always said that red wine is great for your skin and very rich in antioxidants. Well, that doesn't mean we keep having red wine, because that will just dehydrate our skin further, right? So there, everything has its pros and cons, and a diet which everything that you eat or drink will reflect on your skin and on your hair. So clearly, what you need to do is eat right, eat a well balanced diet. Green leafy vegetables, please add them. Add broccoli in your diet whenever it's available, other leafy stuff, and things which are rich in antioxidants. So instead of going to the red wine for your antioxidants, please have some berries, have some strawberries, cherries, pineapple. These will give you diet rich in antioxidant. Spinach is another one. Add some nuts to your diet, and please keep yourself well hydrated. I hope that answers somewhat, Anmol. Pranjal, hi. Is vitamin E, is it good for face as is used in growing hair? Um, Vitamin E is a sort of antioxidant. If at all you want to use it for the face, please use it along with vitamin C, because both of them act in synergism. And for the hair, I don't usually recommend it. For the skin, yes, maybe to some extent. It's a good idea to take it orally rather than apply it, definitely. Hi, Kaja. I'm going to take a few more questions, and I think whatever I can. Thank Kaja. Hi, she's asking. My daughter is 6 year. How to control lice in hair head? Well, if she's got lice, see the surroundings if someone else has them as well. Otherwise, there's something called there are anti-lice creams and serums. Permethrin is one of them. Permethrin 1% cream. Put it on the scalp for about 20 minutes. Cover it well with the shower cap. Wash it off and repeat this process in maybe 10 days, because that's when the eggs of the lice will hatch again. And do this twice, and that should decrease the lice in the hair. And as for the nits, use a very thin comb. Aman Arya, he's asking, hi Aman, can birthmark patches be removed? That's a tricky question. Birthmark patches, it depends on the kind of patch that is there, and to some extent, laser and surgical procedures may help in this endeavor. Um, Venkatesh, again, he's asking, is glutathione tablets better or injections? Venkatesh, why don't you write me directly and I will help you out with it? IV injections, little more challenging and little more tricky to use. That's all I would say. Tablets, easy to use. You can straight away start them. Hi Bipin, how are you? Doctor, what is your message to the viewer who major use any over-the-counter topicals for skin lightening or from regular parlor or salon? Is it safe? Thank you, Bipin. Thank you for asking that very, very important question. Uh, Please, my answer is simple. Please, please, please don't use over the counter medication. There are, as the Indian Society of Dermatologists, also now we have enough information out there creating awareness about this. Many of these creams have cortisone in them. They are not good for your skin. They will thin out your skin. It will result in repeated acne. It'll clear your skin first, but it'll bounce back with rapidity. So please refrain from that. And if you've got a pigment issue, visit your doctor and take advice before using anything on your face. Um, Thank you so much, everyone, for joining this. I'll just maybe so. Yes, Suresh. After using a sanitizer on a hand, don't go near the flame. It is right. Sanitizers are full of alcohol. So if you go near a flame, it's not a good idea. Thank you everyone for joining us. There will be info on the page if you want to directly contact me or DM me, because time's up. I think we'll need to wrap up now. You can write down in the comments section or write to me directly or on my Insta handle. Thank you for joining us. Please be safe. Please practice social distancing, and please, hand hygiene is important. I pray that we all come out of this very, very soon. Thanks. Bye.
You